divided. Let me just continue this. Our attentions are divided. We're on our phones, hooked onto social media, but we're not connected with the people right across the street from us, right across the masjid, the masjid row from us. And this is why it's so important to have gatherings like this, especially during this pandemic, where we can talk to each other and really hear each other's stories. So I really, really am going to urge everyone to share their story with the healthcare system here in the United States or anywhere else in the world, to see, and make those connections, because when we make those connections and we connect those dots, that's when we're going to get collective action. I want you to know you're not alone. All of us have struggled with this. I was without healthcare. My husband decided at the age of 36, 37 to go to medical school with 4 children. And I moved across the country to support his vision. And I worked for a small nonprofit, and we survived without healthcare with 4 kids for several years until the Obamacare came around. And I know that that time without healthcare has had a major impact on my health today, because I was not able to get early preventative care, and I wasn't able, it was just too expensive to go to the doctor. So you rather spend that money on the children or, something else for the home, and you forget about yourself. And so this is my personal story that I wanted to share. It wasn't until we got some aid during Obamacare. But guess what? The minute my husband got his residency and he was able to get healthcare from his employer, we didn't realize that we were going to get slammed with an $11,000 healthcare bill by Obamacare. So at some points it saved our lives, and at some points it devastated our bank account. So that's my personal story that I wanted to share with you. So do you know that you're not alone? It takes a whole community to care for our collective health. And creativity is needed to make scientific breakthroughs. That's another point that I really want to emphasize. Let me share with you the work of the Aymara women of Bolivia, who adapted their traditional weaving skills to create life-saving devices to save their children and others from heart failure and disease. SubhanAllah, like their story just inspires me so much. These are women that traditionally we would look at as, oh, they're not educated, they're not doctors, they're not scientists. But when they came together as a community and realized they did not have any other options. And then when we can take that lesson and say, when we work together as a community, sharing our unique skills, we can leverage our strengths to make a lasting impact on our collective well-being. Millions of people around the world have been thrown into poverty during the COVID-19 pandemic. Yet big pharmaceutical companies have reported record levels of profit. Thanks to sales of the vaccine, Pfizer has secured a 134% rise in revenue compared to previous years. The company is now looking to exploit the pandemic even more by introducing another drug to high-income countries while leaving out of reach poor countries. Only to 9.5% of people in low-income countries have received a single dose of the vaccine. Healthcare is human rights. And I say that as a person who works in the human rights arena. I work on anti-genocide. I work on disparities in the Muslim minorities overseas, over here, and healthcare is truly a human right. Let's look at the path that was pursued by Cuba. The island had recently pledged to offer additional support for vaccine distribution in the global south through deploying more healthcare cadres, donating more homegrown vaccine doses, and ensuring technology transfers to other countries. There are so many more examples of collective actions that work. Let me share the story of the Muslim community clinics in various cities around the country that are run by volunteers or now are increasingly being run by grants from local districts, local cities, local counties, because they're seeing the amazing work that is being done. For example, in my where I live, the Maryland Muslim Community Center in Maryland runs an amazing clinic. Now, many of these clinics were started because immigrant doctors needed a place where they could get quality treatment for their visiting parents or relatives that had come over from overseas and they didn't have health insurance. So, and often they would get sick or would need healthcare or would need prescription drugs. So they started these clinics. Others, like the Ummah Clinic in Los Angeles, I'm from Los Angeles, so started because the Muslim community wanted to serve the broader community. These collective actions have resulted in goodness, because what happened? People pulled in their friends, their relatives. Oh, you're a nurse, you're a doctor. Can you come, donate 10 hours? People just got together and decided to change the system and think outside the box. Let's look at an example from the wider Black community. Imagine this. It's the 1970s in Pittsburgh. An emergency medical technician stands in a hospital emergency room presenting the patient he has brought in by ambulance. He gives a concise description of the patient's medical history, vital signs, and physical exams to doctors and nurses. Now, this scene seems very normal to us, right? We're used to the emergency medical system, the EMS system, where people come in, 911, you call them, they come in, and then they give those stats to the doctors and nurses. This scene unfolds countless times a day in hospitals around the country today. But at that time in Pittsburgh, it was shocking for two reasons. And this is based on an article in the Journal of the History of Medicine and Allied Sciences. For starters, the idea that a sick person would be brought to the ER by someone trained in medical care was a novel concept. Critically ill patients often got to the hospital in a station wagon or hearse, driven by a police officer with minimal first aid training. There was no attendant by the patient's side and no life support equipment. So just as astounding to the doctors was the medic standing before them. It was often a poor Black man from one of Pittsburgh's inner city neighborhoods, previously considered unemployable. And now he was trained to provide advanced cardiac life support. This is how an all-Black paramedic service that ran from 1967 to 1975 helped establish the national training model for emergency medical service programs. That experimental ambulance service began with the help of Peter Safer, Dr. Peter Safer, and his name, S-A-F-A-R, that's a very Muslimy name. So I really want to look into that, what his background was, or how he came into the country, or who his ancestors were. So he was a critical care pioneer, considered the father of cardiopulmonary resuscitation. While at the University of Pittsburgh, he became focused on improving life-saving measures in critical moments before patients got to the hospital. So in 1967, he was approached by leaders in the predominantly Black community around the Presbyterian University Hospital who wanted to provide better transportation for their residents to receive medical care. He saw an opportunity to test out his vision for national standards and thus started emergency care that we know today. He trained people from the neighborhood who would provide 24-hour emergency medical care and hospital transport in 2 districts. And in that way contributed to this amazing system that we have today. I will share the story of Abdul Sattar Eidi from Pakistan, whose ambulatory services run throughout the country. Pakistan does not have a national ambulance service or even statewide services. 99% of the ambulance services in Pakistan are run by charities, people who got together, himself, who didn't have much money, who got together and through donations started these services for their communities that the government could not or would not provide. In Zimbabwe, I love this story. I'm part of the founding board of an organization for mental health that works on an alternative to mental health, the Sadie Peter Delaney Foundation. And one of our inspirations was this story out of Zimbabwe, where mental health had become a very big challenge. There were fewer than 20 psychiatrists to a population of over 14 million people. To help create accessible and effective care, a psychiatrist by the name of Dr. Dixon Chibanda began a talk-based cognitive behavioral therapy called friendship benches. So he trained grandmothers to become health workers for their communities. And these grandmothers had astounding results. And the recent clinical trials found they are more effective than conventional medical treatment. And he has taken his idea online and is giving the world access to a virtual friendship bench. And in these benches, I mean, it's subhanAllah, the stories are beautiful. So on a small bench in Zimbabwe's capital, Harare, two women sitting in the middle of a conversation. The older woman is Lucia, and she's asking Emily, the younger woman, how her plans to fund her vegetable business are going. So Zimbabwe also had this anti-homeless campaign where they cleaned out this, quote unquote, cleaned out the streets and removed 100,000 homeless people from the ground, from the streets. And this caused massive trauma in the community, massive, put already traumatized, unhoused people into further trauma. And so this bench that Emily and Lucia are sitting on are in the open, and there are 250 of these benches in Zimbabwe in total. And they've become this innovative and highly successful way to offer an ear to those struggling with mental health. By making therapy accessible, they're helping solve not just Zimbabwe, but the mental health crisis around the world. We're inspired with this. Our really great friend who's working on this is trying to get benches put into inner cities in the United States. And Emily and Lucia aren't friends. Emily's a client, and Lucia is part of the community of grandmothers who help individuals struggle with depression, anxiety, and trauma. And the grandmothers are trained and drawn from the community around them. And this simple act of turning benches into a destination for therapy is having these amazing results. And, they started off on small scale, and obviously things have evolved, but this idea of using grandmothers is just so amazing, because a lot of times grandmothers might be retired, or they might be alone, lonely themselves. So it's like the community is providing, not only our mental health patients getting treatment, but the grandmothers themselves are also getting repurposing their lives. And these situations, many of these situations that they face are situations that we face. So imagine if there were friendship benches around your community, around your homes. So I really, I know I've been going on for a while. I'm going to say two more things and I'm going to end this. Let's look at the Muslim community in America. Muslim Americans, and I wanted to look a little bit deeper into our faith, how we can present out-of-the-box ideas that would benefit the broader community. Islam is a very collective action. It's an embodiment of collective action. We our prayers are multiplied when we pray together. Our food is blessed, we believe, when we eat together. So Muslim Americans represent a community that's ethnically and racially diverse, yes, yet is bound by a shared religious tradition that shapes their health behaviors and healthcare experiences. So an average estimate of Muslims in the US is around 5.4 million, while some sources suggest 3.4 million and some say up to 7 or 20 million. Major ethnic subgroups include Indigenous, African Americans, South Asian Americans, and Arab Americans. although Muslim Americans come from diverse ethnic backgrounds, their religion serves as a unifying cultural dimension. So many aspects of health may be informed by their practice of Islam, from conception of disease and cure to interaction that Muslim patients have with the healthcare system. So much of what is accessible, and this is something that we should be really studying too, as alternatives to mainstream ideas, research into our healthcare system, our healthcare ideas, and how Islamic beliefs and practices affect our health. So some of the studies that I was reading suggest that Muslim practice may both hinder and enable good health. For example, with the rise in research in intermittent fasting, there is so much scope in Ramadan fasting. And I recently, Dr. Berg is somebody like millions and millions of people follow him and watch his videos across the world. And he's a big proponent of intermittent fasting. And recently he did this video on why Muslims are have less heart attacks and diabetes in certain countries. And Ramadan fasting it was a big thing that he brought up, but done right? Like you can't be fasting all day and then indulge in this gigantic meal at the end of the day. But Ramadan fasting, if done right, like the Prophet used to do them, it would be so good for our health, because it helps with insulin resistance, diabetes, all sorts of things like that. That's something, my own story. I'm insulin resistant. I didn't realize it. I didn't even know what it was. And learning more about intermittent fasting and how it can be implemented in my life has really helped me control my diabetes. And by the way, South Asians are more likely to get diabetes, because we have gone historically, because of occupation of our lands, colonization, we've gone through 27 famines that have affected our bodies. So my veins are tinier than other people. That's why we have more heart disease, and that's why we get it's so much harder for us to lose weight because of our bodies are holding on to every calorie, because we don't know when our next Winston Churchill is going to come in and put us through another famine. So yeah, diverting from my talk. Islamic injunctions against sexual promiscuity and not drinking alcohol, as well as recommendations against smoking, also promotes health. And this is collective. And we lose that perspective when we only look at healthcare through that box that is provided for us. Hijama, or cupping, is another Islamic practice that has been relegated to like these shadowy corners of the internet, instead of being this idea, that can really change our lives, because the Prophet ﷺ has recommended it as a sunnah, as the angels, when we believe when he went up to the heavens, at every level of as he climbed up the levels of heaven, every level angels asked him about hijab. Tell your people, tell your ummah to practice hijama. And we forget that hadith, we forget that practice in our life. So our system should be doing a lot for us. We should be working to change that system. But, I firmly believe that, but I also believe that we should be looking at other alternatives and looking at this from a change lens, that we can make that change. These people in power, they're not going to make that change for us. We need to make that change. And I know sometimes that's like, some people will think of that as victim blaming or putting the burden on people who are being oppressed by this system. But we all know, that is the way of our Prophet from a Muslim perspective, and bringing the change that we want to see in the world. Finally, I do want to say that universal access to healthcare without discrimination is a human right enshrined in the Universal Declaration of Human Rights and International Covenant of Economic, Social, and Cultural Rights. There is a healthcare crisis in the United States, with countless people unable to access life-saving care due to cost. And this has a disproportionate impact on already marginalized people. And instead of treating healthcare as a partisan political issue, I believe it should be addressed as a human rights issue. And that would mean putting in place a system of universal, equitable, non-discriminatory healthcare, giving priority to perhaps a single payer, publicly funded system to guarantee access to comprehensive quality care for all people as a right and a public good. But until we get there, let's look at alternatives that we can do in our own communities. Thank you so much.
Thank you so much, Sister Hena Zuberi. We're so glad to have had you, and you were hitting it not only around all of the bases, hitting all the points, but out of the ballpark. We appreciate it, and we will come back. We will bring Sister Hena back when we come back to the forum at the second half of our program. But right now, what we want to do is something that I neglected to do something very important, which is to open up our program the correct way. I would like to ask Sister Fatima Bakr to come forward and do a belated opening prayer or dua, what we call a dua, and put us up in the right way.
Okay. Assalamu alaikum.
Wa alaikum salam.
Okay, Allah. There is no God but He, the living, the self-subsistent, eternal, no slumber can seize Him, no sleep. His are all things in the heavens and on earth. Who is there that can intercede in His presence except as He permitteth? He knoweth what appeared to His creatures, as before, or after, or behind them. Nor shall they compass all of His knowledge, except as He willeth. His throne doeth extend over the heavens and the earth, and He feels no fatigue in guarding and preserving them. For He's the Most High, the supreme in glory. Amen.
Thank you, sis.
You're welcome.
For many Muslims, they'll know that is
let me tell them, I'm sorry. This is Ayat al-Kursi. It's one of the most uplifting and important prayers in the Quran. So I wanted to read that today and start us off. But may Allah continue to bless us. Alhamdulillah. Amen.
Thank you so much. And then we are, and everyone, please be patient with me. I'm reading texts and chats while I'm talking to you. So as we get ready for our speak out, we have a short video trailer. It is from a documentary from 1970s, where people took the issue of healthcare into their hands. In the 1970s, 60s, 70s, 50s, 60s, 70s, heroin epidemic was rampant in northern cities, particularly in New York. And the Black Panther Party and the Young Lords, and this particular action was led by the Young Lords. They took action in the community of Harlem, and he took over Lincoln Hospital. And what we're showing to you is from a trailer from the video, Dope is Death. And we'll see that now.
Growing up in the South Bronx, when the heroin epidemic really hit strong, I got used to seeing the addicts. At one point, there were 100,000 addicts in New York. So I wanted to do something.
doctors and the young lords, they actually were the first ones to bring acupuncture to the South Bronx.
They tried the acupuncture and they saw that it did take the edge off. And so they kept on coming every single day.
Corporate doctors at that time saw everything that we were doing as a threat.
And we got the people who were detox and the community involved in political work. So they all became activists. So we became an issue in the South Bronx and a threat to the establishment.
Trying to tell you, we were calling it free quality health care for all. That was the bottom line for all of this.
I think it's important to realize that the pioneers are always the ones targeted as the fools and the naysayers and all the rest.
7 people from the radical underground were indicted.
We were living in a revolutionary period.
All right. Thank you so much. We'll come back to another later on.
This is for me.
New called the takeover. Right now, we want to open up the mic. I believe that we've got at least about 2 or 3 folks ready to speak. And so I'm going to start the session called the Speak Out. And the Speak Out is centered around you. What are your stories? Sister Hena told us stories of around the world where folks take action, put healthcare in their own hands, and in many ways challenge the system, as well as building institutions to build our lives and our communities. I wanted to ask Sister Cleo, Cleo Silvers. And Sister Cleo, was that you I saw in that clip? That sure looked a lot like you. I want to put Sister Cleo, ask for Sister Cleo open up her video.
Okay. Thank you so much. I was suggesting that people take a look at the film, both films, Dope is Death and Takeover. And yes, I am in both of those films because I spent the last 55 years of my life fighting for free quality healthcare. So just so that you know who I am, I was the person who was both a Black Panther and a Young Lord, and brought the Black Panther Party to Lincoln Hospital for the purpose of helping us to fight for free quality healthcare. But I want to say prior to that, I was raised in a Muslim household. I am not a Muslim, but I was raised in a Muslim household. And one of my claims to fame, if you will, is the fact that Malcolm X used to visit my home on Saturday mornings and listen to jazz. So
Wow.
if you ever want to know about his jazz interest and what Malcolm X loved in terms of the music, I can tell you that little girls were not allowed to be in the same room with the brothers, but I used to sit in the corner in the next room and listen to every conversation. And so that is why I know the response when you say Assalamu alaikum. I know alaikum salam at least, and some other important things about the Muslim religion. So thank you very much for having me here. And yes, I was responsible for the penning of the Patient's Bill of Rights. That is, and I will put the original Patient's Bill of Rights in the chat a little bit later on so that you get to see it. And how did we come to the Patient's Bill of Rights? I spent 2 years knocking on doors in the South Bronx community, the community that used Lincoln Hospital. And knocking on thousands of doors, talking to people, engaging in healthcare struggles, because the South Bronx was a horrible community. It had the highest level of infant mortality, highest infant mortality rates, the highest rates of women passing away, dying from childbirth. It had the highest rates of asthma in the world at that point. And of course, 1 in 4 people in the South Bronx was addicted to heroin. And the Lincoln Hospital was known as the butcher shop. And the reason that it was known as the butcher shop is because you could go into Lincoln Hospital and have a problem with your right arm and have a surgery on your, or suppose it on your right arm, and you come out without a left arm. Of course, that this is really true. And of course, how many people died as a result of surgery. 72 hours was the normal wait time in the emergency room. So what we did is we set up what we called the patient's complaint table in the South Bronx, in Lincoln Hospital, in the emergency room. And we got thousands of complaints about the conditions that that the people were receiving as what was called healthcare at that time. And it was not quality healthcare at all. It was not respectful healthcare. It was not healthcare that was going to help. It was not healthcare that was preventive. There was no preventive health. There's hundreds of preventable diseases that were not being taken seriously. And by the way that I got into Lincoln Hospital in the first place was because I was hired as a community mental health worker there after that 2 years that I spent in working in the South Bronx community. And the 2 films, one is about the actual takeover and the fight for free, quality, preventive healthcare for all. We established a door-to-door testing program for lead poisoning, for diabetes, for anemia, for tuberculosis. At one point, the young lords even stole the tuberculosis testing truck to use it in the East Harlem community. And then our third takeover. So there was the takeover of the workers. I was involved because I was a community mental health worker. There was a takeover to demand quality healthcare and to get rid of the administration. My job during the takeover was to walk the administrators off the property because they were not doing a good job of administering a hospital that was responsible for taking care of 800,000 people at the minimum, and that it is possible for 800,000 people to receive quality health care. And our demands clearly showed that not only were we making demands, but we were showing and we were exposing the fact that these demands could be met and that people could receive quality health care. We also were responsible, as a matter of fact, I want to mention that the Black Panther Party was the first group of people to demand that sickle cell anemia and sickle cell disease be researched. It was not recognized as something that should be researched as a disease that was important to society until the Black Panther Party demanded that the NIH take up sickle cell. The other thing is the free breakfast program. The free breakfast program was a health issue, was response to the fact that parents did not have money to feed their children, to be able to go to school and to learn on an equal playing field of those children who were able to have a quality breakfast. As you know, breakfast is the first and most important meal of the day. So that's, people talk about, all the terrible things that the Black Panther Party did. And I can tell you as a member of the Black Panther Party that these are part of the wonderful things that were done by the Black Panther Party. Dope is Death tells the story of how we took over the nurses' residence, and we did not make a demand on the hospital. We just started a drug rehabilitation program that did not use chemicals at all. And we began it without the chemicals. We used cupping, we used rolfing, we used acupuncture, and we used political education, so that the people who were detoxed, and by the way, I'm very happy to answer questions. The people that were detoxed got an opportunity to go out and become some of the most courageous community organizers fighting for quality health care, not only in the South Bronx, but throughout the world. The last thing is that in the 2000s, I was able to, I know you want to stop me. Yes.
No, we will give you time. This is amazing. And you should see the comments going around in the chat. You know, had I known, I would have snatched you in the beginning, when we were pulling folks together. But we do want to make time for other folks to tell their story. So we got to the forum. We got another section to this.
I'm sorry.
Don't throw those papers away. We will give you a chance to tell the rest of that story at the other forum, in the other part of the program. And we will, yes, definitely, Brother Munir, I agree with you. Sister Cleo, we got to have you come back. We're going to do a working session with you. And really, because this is the kind of work that we are talking about doing. So we applaud you. We thank you so much for these lessons. Didn't know we had a movie star here. So let us go on and come to the next couple of people. And I know the brothers are keeping and Dana are keeping track of time. So I'm got them in my ear as well. And we will come back to you. Thank you.
Sorry. Thank you
so much. Okay. Sister Fatima, are you ready? I think you had a story, and then I think after that, I heard brother Musa was ready, and I'm checking.
Assalamu alaikum. Which Sister Fatima?
There's more than one. From what I understand, Sister Fatima Baka.
Okay.
All right. There's more than one here. Yes,
yeah,
there is. Sister Fatima Adekola out of Philly. All right, sister. Thank you for joining us, Sister Fatima Baka. And if we could keep everyone, maybe we could try go for 3 minutes, so we can do a go around, and then if we do the go around and come back around to other folks, just to give everyone a chance to speak. How about that?
Okay,
right?
that'd be good, because mine is kind of fast, but I just want to let you know what happened to me and the results of not having health care until Obama's health care came in 2014 for me and my son. Before then, I had an issue with no insurance, but I was on another, what you call it, a scale right quick with the doctor by not having insurance. So I could only I had leg pain in my leg, my right leg. I only could get x-rays. I couldn't get anything else because I didn't have insurance. So for a whole year, the leg was hurting and hurting and hurting, and I would get, she send me to get x-rays and give me naproxen. That was it. Next thing I know, when I finally got Obamacare, I found out at the end of 2014, I found out that I had, in January 2015, I was told to go to a pain doctor. She sent me to, and that's the specialist because now you have insurance. She sent me to go get a CAT scan. Got the CAT scan. They seen protein levels. Come back to the doctor. The doctor calls me in and says, I need to send you to another doctor, which is the cancer doctor. Go to the cancer doctor. They found out I had multiple myeloma. This is all because no insurance. So now, and this is 2021, 22, I still taking chemo once a month for multiple myeloma to keep it in control. And it could have been avoided like my oncologist said, if I would have had insurance in the beginning and they could have caught it, where we could have demolished that with the help that they have. So I know that what my experience was. I'm not going to be on here long. I know what my experience was, and I know there's still other people out there in this United States or the world that's dealing with things, and they don't know what it is until they get coverage. So I'm just one of the hundreds that's out there. Okay. I don't have too much to say on that, but I think a lot of he's got me able to still be able to work and function and all that. So alhamdulillah.
Thank you, Fatima. Thank you for Sister Bakr.
Yes.
We appreciate that. And now we're gonna go to Brother Musa Lipford. Musa spoke earlier before we started about the issue of mental health. Musa, you ready?
I'm ready. So here it goes. Assalamu alaikum, everybody. The reason why I brought it up because it's a issue that is not fully addressed among the Black community, and it's not really addressed. And it really affected me. How it affected me personally is I had a friend. I had a friend who he was a pretty cool guy, and so I hanged out with him and found out that he had mental issues, and so he was getting taken care of, but he ended up going back home, and so he actually called me, and he was like, "Hey, can I come down just to visit? Because I got some my daughters I want to actually come in and see." And I said, "Well, I didn't have a place to stay because, living with parents and stuff, and you're under their rules and stuff." So after that, I got a call from another friend that he committed suicide, and so it was very devastating. And to me, what's going on what's on the news, what's happening with the one, I think she was Miss USA, and other stuff I'm hearing. This has become a very, very issue that I think needs to be addressed. They say that Black don't crack. Physically, yeah, but I think mentally we do. And I think that this needs to be addressed. Bad enough we have gun violence in our community, Black people killing Black people, which is sick. But I don't want this to become another Black on Black situation as well too. So I give the floor back to you.
All right. Anyone else? We are checking in with folks in order to give you the floor is yours. And we're not only looking about issues about lack of insurance, but possibly wrong medication or disrespect. I've been told of a situation where a young lady was pregnant. This is up in Halifax County, North Carolina, and she was in labor. And the doctors insisted on giving her one medication, even though she told them that she was allergic to that medication. And it ended up that she ended up walking out of the hospital and going to another facility, even though she was in labor. So these are the kinds of things that are going on. We know that in Black and Brown communities in this country, that what is called maternal mortality, something that Sister Cleo was speaking about, is comparable to, you know, other countries, underdeveloped countries, and that speaks to, you know, our colonized relationship to, you know, to this overall system here in the United States. So the floor is open for everyone to speak and tell us about your story. We've also had cases, similar cases. One of the members of Black Workers for Justice was told by her doctor that she needed immediate surgery. She had a heart condition and she needed immediate surgery. And that was her story until, or the doctor's story, until he found out that she didn't have any insurance. And so he told her that when she had some insurance to come back, and that he would be, they would be glad to schedule her. So all of a sudden, the whole system, her whole situation changed. And so we, you know, encouraging folks to speak up. Tell us about what maybe what you or a friend of yours has faced. Again, that could be any kind of an issue. And if not, then we'll bring Sister Cleo back. We're encouraging that. She did have a third part to tell us about. And I'm sure that with a number of issues that we are hearing second and third hand, that this is just letting you know this is a safe spot. That's part of the reason why we had everyone register, so there would be no bombing of this site or bombing of this forum. But this is your forum and our forum. This is family. All right. Sister Cleo, I'm gonna throw it back to you. With our time now is what, 11:56. Actually, we may not need to do that because I'm expecting Sister Dana to tell me I have a 4-minute warning. But Cleo, would you like to give us a taste of what you were going to tell us about when you first started?
Yes, comrades, I'm going to go fast. I'm going to try to speak very quickly because I do have some things to say about healthcare and in community. South Bronx is a community that's,
well, if you could just give
are horrible, but it's not any different than many communities around the world. And one of the other things is that there were no places where you could go and get, if you were addicted to heroin. Well, first of all, they were bringing the heroin in huge amounts into the community. And that was the government bringing heroin into Black communities to stop the activity, to stop Black people and people of color from being activists and demanding the things that they needed, and they needed everything. So we started the drug detoxification program because they were using methadone maintenance as a form of dealing with healthcare, with drug abuse, drug addiction. And we were demanding that they get the chemicals out because that's just another way of enslaving people to these horrible chemicals. So we went in, we started our drug detoxification program. I left New York City in the early 70s and went to Detroit and worked in the auto plants in Detroit. And that is a personal story that I would love to tell at some time. I returned to New York City after living in Los Angeles for a while. I was married to a jazz musician, by the way. So that's why I was traveling all around. And we began to build and establish community gardens all around the community, so that because there were no there were no grocery stores where you could go and get fresh vegetables. And the only way that the children and the people would have access to fresh vegetables that you need to cleanse your body to eat instead of the things that are sold in the bodega is to have community gardens. And I am suggesting that community gardens should be everywhere. It is a way to bring people together, and it is a way to keep people healthy as possible without the quality healthcare that we need. The other thing is my own personal story. I moved to Memphis after having traveled around and lived in big cities. And of course, you know, I had 3 heart attacks. I've got diabetes. And my last heart attack was in the last year. And I went to the hospital here in Memphis, Tennessee. First of all, they had taken down all the patient's Bill of Rights out of the whole hospital system. But we're going to change that. That's going to change significantly in a few more weeks, because we're not going to have that. But you have to know that Memphis, Tennessee is the city in which they murdered Martin Luther King, Dr. Martin Luther King. Black people did not have access to the library or public spaces until 1965. And in order for that to happen, they had to go to the justice system, to the Supreme Court, in order to gain access to public spaces in this city. This is a very segregated and a very racist city. So I go to the hospital, and my cardiologist, my new cardiologist, says to me, you need to have an angiogram so we can take a look at all of them little veins and arteries that go to your heart, because they're all plaqued up. So I get on, they take me to this horrible little room, and they put me on a table, and they're giving me an angiogram. This doctor is giving me an angiogram, and I'm saying to, and they don't completely sedate you, so you're slightly awake. And I looked up at the doctor. I said, Doc, this is hurting me. I wish you would go a little slower. He said, shut up. You don't know what you're talking about. That is the kind of treatment that I'm sure not only it happened to me, I can imagine what is happening to poor Black people and people of color. So,
and with that note, sis,
thank you.
Thank you, sis. We appreciate that. Don't go anywhere. Don't you dare get off the phone. Okay.
I'm not going nowhere. I love this. I love y'all. I do. I really do. And thank you so much for the work that you're doing. So I agree with you.
Careful what you say. You might get snatched up. You might be planned. I got a plan for you. At any rate, thank you so much, Sister Cleo. We are going to transition now and switch over. We got a little bit of music to transition, and following that, we are going to shift to our panel. And I think our panel will be Sister Ruqayyah Ali out of Philadelphia, dealing with mental health, and Dana, who's been in the background dealing with the Medicare for All campaign. I believe there's a slideshow, and then we're gonna snatch Sister Cleo back up. She ain't know that. I just told her. So without further ado, let's switch over to just a little transition music while we get ready. Thank you, everyone, for your attention and support.
Let that hair look nice. Don't that make you sweat? Don't that feel too tight? Yo, what your hair look like? Let your hair look nice. How long your hair is? You need to get your life. You only see Oriental. You steady working that dental. You popping off like a lip and on your mouth like a treadmill. Not your exotic vacation. I'm bored with your fascination. I need that paper if you want education. All around the world, love women every shade of hair. We was born in the 80s, so pretty like the Euphrates, and party like some Kuwaitis, deeper than some diplomas, current like some hot yoga, taking back the misnomers and teleporting through trauma, I've been stacking my karma, Nefertiti, no drama, make a feminist planet, woman haters get banished, covered up or not, don't ever take us for granted. All around the world, love women ever shade it. these mixtures, these hippies, these pussies, these Sufis, these Reddies, these Sunnis, these Shiites, Yemenis, Somalis, Lebanese, Pakistanis, these Sudis, Sudanis, Iraqis, Punjabis, Afghanis, Yazidis, Khadijis, Indonesians, Egyptians, Canadians, Algerians, Nigerians, Americans, Libyans, Tunisians, Palestinians, hidden beyond the Mekong and Laos, Senegalese and Burkina Faso. I still rap my hijab, rap my hijab, rap my hijab.
Hello, greetings everyone. I'm actually was waiting for Sister Shafeah to see if she is doing introductions. If not, I can go ahead, inshallah. And thank you so much. I really want to appreciate everyone. So powerful testimonies, and especially Sister Cleo. This is so powerful. We are honored actually to have freedom fighter amongst us, and learning from the history of Black Panther and Young Lords to take the power in our hands. That's the most important thing, to understand the power, and we will follow your footsteps, and everyone else in the chat, in the section. So thank you so much. I will move it to Sister Ruqayyah Ali. Thank you so much, Sister Ruqayyah Ali, for joining. And I'm trying to look at the notes for your introduction. So just give me 1 second. I apologize for that. So Sister Ruqayyah Ali is a certified instructor in mental health, first aid. She was involved in the community and national activism to elevate the cause of social justice. She's involved in food justice, community outreach, and spiritual education. It is a great honor to have Sister Ruqayyah Ali. So please unmute yourself, and you can start talking now. Thank you so much.
You're most welcome, Brother Mansour. And thank you so much for inviting me. Thank you for all the people who've come to hear, to listen, to share. Thank you for your courage and being involved in caring about this such important topic. I was asked to speak about mental health and how to organize Muslim communities for mental health awareness. And of course, you know, I believe we'll start with the fact that in my childhood, there were mental health issues in my family. And in those days, as you all know, those things weren't talked about. So it was actually my grandmother's second husband. And when I was a kid, I was always make sure I told people that's my step grandfather, because I didn't want people to think that he was mentally ill and I was blood related to him and it was contagious or something or inherited, because we just had no knowledge about what mental health illness was. He had gone through, you know, as some mental health illnesses go through episodes. And for some years, everything was okay. He was fine. And then he was having an episode again. And it got to the point where he was just doing dangerous things in the house. My grandmother felt like we were in danger as her grandkids. So he was finally, for the last time, hospitalized. I remember going to the hospital with her, and he was at a place called Byberry. Now, only a Philadelphian would know about Byberry, but it was a place that was like, they called the snake pit, where people went and they basically kept you sedated while you were there till you passed away. But I would go there with her and watch the people, and had a lot of interest and curiosity and all of that. I wanted to go into the health field then, but my mom and my grandmother said, no, go into education. We don't want you going into health. So I went into education. Later on, like year 2012, I got a chance to take mental health first aid training. And that's when I was coming back to the field of mental health. And it was basically a program to make the common everyday people aware of mental health illnesses, the signs and the symptoms. And oftentimes we don't know about those. And we tend to see people's behavior as, you know, escapist. For example, somebody won't get up and go to school or won't go to work, we'll say, oh, they're lazy, or they're just trying to avoid a test. Or, we see different signs and symptoms. We make up excuses, but we're not really looking at the real issues of what may be bothering a person. A person may be depressed, he may be anxious, and mental health first aid helps you to really understand those concepts, what might be motivating a person, and share that with others so that they can recognize and respond to people who are going through mental health challenges or crises. I want to show you here, if I can share my screen for a minute, I'm going to show you what's called ALGE, the 5 steps in mental health first aid awareness, and what we can do to immediately help someone. May I share my screen now, Mansour? I'll try it, but without it. Let's see. Okay, so I'm going to share my screen here. Okay. All right. So this is called the ALGE plan here, and you will see these 5 steps, ALGEE. These are 5 steps to mental health first aid that we share with young people, older people, anyone who comes to a training, and that we really, try to internalize ourselves to respond to someone. So how to approach, assess someone for risk of suicide or harm. All right, if you see someone and you find that their behavior has changed, they've lost interest in a lot of things that they used to love to do, they're either overeating, undereating, so many things that you notice as behavioral changes. These are some of the ways that we try to approach that person and encourage them to get the help they need. So the most important thing in approaching a person who may have a mental health challenge is exactly that, how to approach them. You approach them critically, you approach them blaming, you approach them pointing your finger in them. So your first strategy is to figure out the right approach, okay, and then how to assess them. So you try to find a suitable time or place to start the conversation with the person, keep their privacy and confidentiality in mind. If they don't want to confide in you, maybe there's someone else that they'd like to talk to. You may not always be the person. Now, certainly if you assess them for risk of suicide or harm, there's no need to go through any other steps because you really want to get help for them immediately. There is a hotline now for Muslims. It's called Salam 741-741. That's a hotline that is particularly for Muslims because they will ask the kind of questions that Muslims can answer and that will pertain to the Muslim way of life. But 741-741 itself, without any other words, is a hotline number that anybody in the country can use. And then if that person opens up to you and talks to you, you want to learn how to listen non-judgmentally. How do we do that? I mean, that's very hard. Most of us, the people, we like to talk to people, we like to lecture them. We want to tell them how much we know. We're more likely to listen to people in order to give them an answer or response rather than just listening to them. So we have to really learn how to listen, how to have empathy, and how to let them be heard. Okay, so you can get the conversation started by saying, I noticed that. I noticed that you haven't been cooking dinner lately for your family. I noticed that your children are hungry. I noticed that you don't do some of the things you like to do. You used to go to the gym. You used to come out and walk. You used to come outside and water the flowers and such. And I noticed that you're not doing any of that anymore. And, approach them in a way where you have an I question, first person question where I noticed that, rather than saying, you haven't been doing this, you haven't been doing that. What's the matter? What's up? We want to approach the person in a non-confrontational way so they'll open up to us simply warm. Try to be accepting even if you don't agree with what they're saying. Your main goal there is to listen and let them know that they can be heard. The G step is give reassurance and information. After someone has shared their experiences and emotions with you, try to give them hopeful facts and information. I was reminded lately by an Imam here and the khutbah that the Prophet Muhammad, may Allah bless him and his family, always provided hope and optimism to people. He never was negative. He always ensured people there could be a better future. It may require some changing in your behavior. It may require some changes in your habits, but there can be a good positive future and a good positive outcome in most situations, right? So give them reassurance and information that you think will be useful to them, you think that they will go toward. And that can be community resources, and we'll get to that next, but that can be things that they could do. Tell them the help is available. and they should seek out help, and you'll be ready to go with them or help them out to get the help they need. Encourage appropriate professional help, and the earlier somebody gets help, the better chances of recovery. So it's important to offer to help this person learn about the options available to them. So we know in our communities, we know that this help is not so immediately available. Again, it's a matter of insurance. Again, it's a matter now during COVID, therapists and mental health institutions are just so overcrowded, so overpacked. There's so much going on. So we may have to wait times. I know there's a family that I've been like kind of listening to their conversation, what their needs are. And they said they had to wait like 4 months before they could get therapy for their child. And one thing about mental health issues is that they're very common. We don't need to think that that's rare, as we pointed out in the other situations that people spoke about. These situations are very common. Many people waiting to get help, and particularly when it comes to mental health, there could be more delays. And it's the challenge upon the family, because there are institutions and places where people go. They often don't feel welcome there. They often feel confrontational there. They often feel that people are only there to get a paycheck, people are only there to put in hours and not really caring about them. So it's really a rough road to navigate. But we can also encourage that person into self-help and other support strategies. What is it that they can do for themselves to help themselves out? And we talk, so that has to go with self-care. That has to go with kind of thinking about what's been going on in their life, who the people have been affecting them, and identifying their support network, programs within the community, and creating their own personalized emotional and physical self-care plan. I'm going to look at some self-care things here, and then I'm going to get to the role of the Muslim community. Okay, we talk about how to care for yourself while practicing physical distancing, and how to care for yourself. If you find some mental health issues arising, what can we do to help ourselves? Sometimes we need time. Sometimes we need rest. Sometimes we need to de-stress. So we're talking about eating healthfully, and that's come up before. Sister Rim mentioned about, the Panther Breakfast Program was a response to the fact that in order for kids to study, in order for people to learn and have attention, they need to eat healthfully. What is it that they need? We talk about food deserts within brown and Black communities where there's no supermarket. And recently in Philly, they've kind of made some laws where these markets have to at least carry, you might find fresh tomatoes and lettuce, where before it was just, steak sandwiches and bread and sweets and such. But, how can we have more access to fresh food? Yes, gardening is really, and one of the options, community garden is really so good. But how can each person learn how to keep their body in top working order and deal with some of their needs? We talk about B vitamins. B vitamins are very important for the nerves and the health, all right? Exercise, work out at home, or take a jog around the neighborhood. You may, if you want to help that person, say, I'll start walking with you. Let's take a walk every morning. Let's meet at the gym. What is it we can do to get that person physically involved? Sometimes there will be therapists that can come to a home and help a person out, but that body needs to move. And there's some relaxation therapies, tensing and relaxing muscle groups can help you relax voluntarily. How to lie down in bed before sleep and really relax that body and remove the tension before you go to sleep. Because if you sleep with a lot of high tension, you're going to wake up tense, and you're already starting the day with your problems kind of increased. Let light in. Sometimes people don't open their curtains, don't open their blinds. Exposure to light can improve symptoms of depression. So let more sunlight in, be out. And we know when we talk about sunlight, we're talking about vitamin D. And when you talk about vitamin D, you're also talking about COVID-19, because vitamin D has been shown to be one of the best therapies and treatments for COVID-19 prevention and care of it. And we know that they said that people with dark skin colors, we are more resistant to vitamin D from sunlight due to the melanin in our skin. So by getting vitamin D and having it more available in the communities is something that's going to help a person with their mood, because vitamin D is shown to be actually a hormone that affects your mood. So we all need that vitamin D, that natural sunlight, or we need supplementation. Be kind to yourself, okay? Just having a problem or a mental health issue doesn't mean that you now find you condemn yourself. I'm no good. I don't deserve to live. All of that. It says treat yourself with the same compassion you would a friend. And recently, one of our Muslim sheikhs, Sister Aisha Prime, talked about something. We talk about self-talk. where people actually talk to themselves, they curse at themselves, but they say, don't talk to yourself any worse than you would allow a friend to talk to you. Talk to yourself with kindness, talk to yourself with compassion, and so that you can have a positive image for going forward. But most important, monitor your media consumption. People have a lot of issues starting about lack of self-sufficiency because they see everybody on, whether it's YouTube or on the videos, on Facebook, they got this new car, they got this new clothes, they got this new man, they got this whatever, and they start comparing themselves to that person. And this is, to create certain problems. I have a young lady that I mentor, and she had been looking at Facebook and the movies on, Netflix and such. And she met somebody online, and she immediately thought that she was going to have what she said a YouTube marriage. That's what she called it. She did get married against the advice of her parents and such. And once she got in that marriage, she learned the reality. One of the things was the young man she married didn't want her to go to school, didn't want her to work. He had very limited ideas about the potential of a woman, and then some physical violence started creeping into it. And I really commended her and congratulated her because she got out of that situation. But how many women will stay in a situation like that and blame themselves? So the media consumption without proper guidance, and particularly young people, we know, as it says, the brain is not fully developed till the age of 22 to 25. So young people are not fully thinking about the consequences of things that they want to do. They're not fully thinking about, what's behind that story of that person on Facebook, Staying connected to your loved ones, phone calls, text messages, video chats, and social media. And we're talking about loved ones and family that are supportive, not family members that are negative, that are critical. How to help that person, how to be that person that you can talk, that they can feel like they want to talk to someone, they can call and talk to you. So those types of things, self-care is very important. And when you look at the stresses in your life, say you have a list of 10, okay, stressors. You need to have at least 10 ways that you relieve that stress. We talk about a scale that has weights. So if you put on that scale, care of my child, going to work, my own health, my worries about my bills, my worries about the neighborhood, and a city like Philadelphia has a lot of neighborhood stresses, everybody who lives here, and almost any big city in this country, the stresses of just living and hearing the news every day. I live in Philadelphia, like I said, and a few weeks ago, I was just at home, and I kept hearing fire engines and police cars going up and down my street, up and down my street. And it was just so much, I thought, what's going on? I mean, this looks really serious in terms of they were going to the place, the big fire in Philly on Fairmount, which I'm sure everybody's heard about now, where these 15 people lost their lives. And then there was a big fire in New York where a lot of members of the Muslim community lost their lives. So we're living in areas like this, there's this type of stress that you call, you may not be affecting you personally, but you take on some of the energy of that and it affects you. So you want to try to stay connected with people that will kind of help you keep that positive outlook. You want to help that person to find who they connect with and who helps them to, I'm going to stop sharing, to helps them to see themselves in a better light, and particularly help them to use those self-help strategies. Okay, how do we organize in the Muslim community for increased awareness of mental health issues? That's really a challenge. And oftentimes, most programs that you see that are really helpful happen outside of the Muslim community. Just in recent years, the Imams has been taking courses and classes in mental health, marriage counseling and such. But before that, people would just go to them for advice, and they often didn't have the information that was needed. I talked about I wrote down some notes about how we can establish functional communities. And we need to start looking at all the needs of all the segments of the community: marriage and parenting, education for children, youth activities, women's activities, and activities for older people as well. We recently started a committee here at my masjid here, United Muslim Masjid, and it's called the Aging with Dignity Committee. And Fatima Nicole is on here. She's a member of that committee. And we have really done some things that have kept us all connected to each other, kept us functioning, actually helped us to serve others. One of the things that we did right after the pandemic, I called a Zoom meeting of the sisters in the community because we hadn't seen each other for weeks to see how everybody was doing. And when you listen to people talk, I mean, there were people crying, there were people talking about, just starting to learn how to work at home, just how to just adjust to the changes. And we're not just talking about the Muslim community, we're talking about any circles of people. Being human, being humane applies to all people, and we all feel an increased awareness of our expanded role as human beings. How do we reach out to people? How do we show people we care? How do we, just by passing someone in the street, and if you follow the path of all the prophets, they were all the same. Jesus meant peace, Muhammad meant peace. And so, how do we do those type things? And this committee and any group of people can do this. What happens is when the committee started, we thought our major role would be visiting people in the hospital. How do we visit the sick, organizing visits. And then came COVID and there were no more hospital visits. So what do? We did design a beautiful get well card. And you may think, and we grew up with our parents, our aunties and such sending get well cards, and you may not have thought much of it, but this card is really beautifully designed and it has some sayings on it about health. And we sent it out, and I sent it out to neighbors, not just people in the Muslim community, send it to people to know that there's people in the community who care and that you're connected with your community, and people appreciate that because sometimes people may feel the mosque is very distant for them. The church is very distant from them. And so to know that even though you're ill, even though you're isolated, there's people out there who care about you and want to connect with you. One of the things one of the other things that happened when we started this committee, someone came to me and said, Sister Ruqayyah, there's a group of people who deliver food. And they want to know if you have a list of people who would appreciate boxes of food regularly. And I said, yes. So we went in the committee, we made a list of about 50 people right offhand. And then I was told, we can't deliver the food to those people. You all have to deliver it. And that really opened up such a great opportunity because when we started delivering food, we go get the food, it's maybe packed already in boxes and we may have to pack them ourselves. But that allowed me myself to visit relatives that I wasn't seeing, to visit people who are isolated. And so that got you, even though with social distancing, you wouldn't go into their house, but you could meet them at the door, talk to them, how you're feeling, and just greet people because that wasn't happening, And so that was really a wonderful opportunity that is still going on now, where we're taking food to people and meeting people. And it's just a wonderful thing. And again, that makes people feel connected to their community. New neighbors. Right now in the city of Philadelphia, and of course with the Afghan refugees coming in, there's a lot of people coming into the cities that need help. There's a Muslim sister that just came in town and she says, I need to know where do I get food at reasonable prices? Where do I get clothes for my kids? Where do I get toys for my kids? And so I'm meeting people with that, helping them with their needs. I remember that Walmart probably has some of the cheapest prices around, although now people are saying, inflation is really true. Prices are going up. So you may find the prices higher everywhere, including Walmart. But I was able to connect her with a sister who says she goes to Walmart regularly to take neighbors for shopping. And I said, can you take this sister? She said, yeah, sure. Give me your number and I can take her with me. So things like that, they seem small, but things like that mean a lot to people who are getting new oriented in a new space. Yeah. And another question came up. A sister moved into town. She and her husband's in school. She's working remotely. She needed help with her baby. She wanted someone to come and help her with her baby while she works. And when I first heard that, I thought, wow, who can I get to help this sister? And I couldn't get anybody to help her. So I myself volunteered for the job to help her. And because I realized being a young mother, how serious postpartum depression can be. That's something that's also minimized. Women who have young kids really need help. They need companionship. So I took on the job of helping this young mother, going to her house every day. And it's really a rest for me to go there and hold the baby, get the baby to sleep, do little things around the house to help her while she's doing her work online. And for me, it's also good because we're also sending out many sympathy cards. Many people are passing. and to be with new life, young life, a baby, and see the hope that new families are being birthed, you know, everybody's coming up, you know, that's really just positive for me. I love being with the baby. It makes me think about when I was a baby, when I had kids, you know, did I pay as much time or attention to them as I should when they were young, because of all the pressures that were on me as well. So that's one way of serving. We're talking about backgrounds of people. Some people are more, you might say, isolated. Some people are more, and particularly in the Black community, a lot of people, if they hear like you're giving out food, they say, oh, I don't need anything. I don't want any food. People don't want to say that they need something, you know, because that's kind of been a custom among many people. And so how to break down that, you know, sometimes you may say, well, instead of people bringing food to them, maybe a person will come and get the food. In Philly, there's a lot of food being distributed in the neighborhoods, on the street corners and such, so much that people said at one point they were satiated, you know, with food boxes and such. But as the time is more, as the time has passed, some of those programs are less. The USDA program closed at the end of May. So there's still opportunities to serve people. Cultural, you know, culture plays a large part in how you approach people, how you talk to people. And in that case, it's very good to listen and to ask questions, you know, ask questions about them, what they like, you know, what they're used to. And people will very readily begin to talk to you and tell you about themselves. We also had a situation here, a long-term care center in Philadelphia, where there are Muslims in those places, and there are Christians in those places as well, and they need spiritual guidance. They'd like someone to come in. So one of the brothers here, he kind of hooked up with them. He and another brother would go there and give the Juma khutbahs at the long-term care center for Muslims who felt really isolated there. We're talking about WhatsApp groups where people get on and talk and share with their experiences. Some people are very shy, some people stand back, but I've had sisters tell me, she says, I see your chat, I see what you post, I see what you're saying. I may not respond, but I see what you're saying, and I get the help, I get the message. Posting prayers all as well. When we talk about nourishment as well, I remember the concept of barefoot doctors, which kind of went along with the care you said you were giving in New York, the roughing, the acupuncture, and that type of therapy. You know, we can all find some basic health information. You know, a sister comes to me and tells me she's feeling pain, what's that, you know, in the joints, things like that. How can we have information to help people where they won't have to go to the doctor? There's so much information, so many ways that a person can help themselves as well. Back to the mental health first issue, I talked about self-help and other support strategies, professional care, professional help if necessary. We want to talk about how you can support a person who's getting therapy, a person who's taking medicine. One of my sons was having some mental health issues, and I think if I hadn't done this training and had been sharing these concepts with people, I probably would not have survived the mental health issue that he went through. And by learning how to talk to him, how to not be confrontational, how to listen to, my husband says, don't argue with him, you know, just listen and such. We were able to navigate that to the point where he was getting therapy, and he started taking a medicine that agreed with him. And now he's very much well, very much loving. And a lot of sisters have met him. If we come to DC for a rally or something like that, he will meet us at the train station, take us around where we want to go. He's very, very well. He survived that. And he's very happy that he survived that, and said, you know, please share my story, because, you know, recuperation is possible. Resilience and being able to, and coping skills are very much preventative measures, and we want to talk about the preventative measures. We know that our religions, Christian, Muslim, Jewish, all religions are basically mental health or the happiness and well-being of society is kind of like the standard. So we're given certain principles, whether it's prayer, whether it's service, all that to keep us at a good standard. And then when things, you know, when crises appear, we should be able to help people be able to kind of dissect what's going on, have people open up to us. We need to always be thinking about mental health. One of the habits of the Prophet Muhammad that speaks so much to me, they said whenever he walked down the street and saw young people on the corner or in the road, he would give them salams.
Thank you.
I think like that.
Thank you, Sister Ruqayyah. This is really, really helpful. We are looking at time too, so this is really helpful. I think in Q&A too, we're gonna come back, but for the time limit, I'm gonna move forward. But this is really, really helpful and extremely important information about mental health. And I will just move to the next speaker so that we can finish on time. But also, inshallah, we'll come maybe in the Q&A with this important information. With that, I will move to Dana Al-Hassan, our last speaker, and then we're going to open for Q&A. Please put your questions. People are already putting questions in the chat section for our speakers on all the topics they have discussed. I will ask Dana now. She's a member of Party for Socialism and Liberation and Muslim for Social Justice, a Palestinian freedom fighter, amazing organizer. So please share her views about healthcare and warfare.
All right. Hi, everyone. And thank you very much, Manzoor, for the introduction. Just getting set up here. So today I will be talking about Medicare for all, money for healthcare and not warfare. And so as Manzoor mentioned, I'm a member of Muslims for Social Justice, and we as Muslims for Social Justice are part of the North Carolina Medicare for All Coalition. This coalition is made up of 40+ organizations in North Carolina. And so if I can see a raise a hand or a thumbs up, I'm opening up my video here. Who here cares about, who here cares about which doctor or hospital you go to? Want to raise your hand or thumbs up? So I see quite a few hands. All right. And so what about who here then cares about who pays for it? Any hand raised for that? Thumbs up. All right, a few, not as much, but exactly right. So the fact is that we want to have ability to choose our doctors and hospitals, and it doesn't matter who pays for it. And this is exactly why we need Medicare for all. So oftentimes we see in the US headlines like, I hope I make it. A 7-year-old Alabama girl selling lemonade to fund her own brain surgeries. Or headlines like elderly couple found dead in apparent murder-suicide, left notes about high medical bills. Man gets $1.1 million bill after surviving 62 days in hospital with coronavirus. Healthcare workers turn to GoFundMe to pay for vital safety equipment. And so these headlines and stories so much overlap with what the previous speakers have talked about, as well as the personal testimonies. These are nothing unique to the US experience, but rather a very common experience among all of us trying to access healthcare in the US. And meanwhile, while we are suffering, the health industry is profiting. They are literally profiting off of our sickness and health. And this graph here shows different sectors of the health industry that are profiting. In particular, you can see big pharma, the pharmaceutical industry almost has 20% of profits, of revenues and profit, which is ridiculous. Many of you might even be familiar with the cost of insulin and how the price of insulin has increased over the years. This graph shows the price from 2006 to 2013, with now an average of $736 of cost of insulin. Today in 2020, it's much higher. But the cost to produce insulin has not changed and has not increased, but the cost for the patient, for the person, for the diabetic who needs this medicine in order to survive has increased. So we can see how the healthcare industry is literally profiting off our sickness. And in fact, total US healthcare spending amounts to $3.6 trillion. No other industrialized country in the world spends anywhere near this amount. And most of this money actually is spent on administrative costs. 34% of the $3.6 trillion are spent on these useless administrative costs, on overheads, on billing expenses, and things that we do not need and that do not actually help us. And so what is Medicare? Most of us are probably already familiar with the current Medicare system. We understand it as a single payer system. You have private delivery, you can choose your doctors, your hospitals. It's successful, it's efficient. Lowest overhead, as in it has less of those administrative costs that I was talking about before. And so clearly we need Medicare, but we need Medicare for everybody. So what is then Medicare for all? Medicare for all is the idea of taking the current Medicare system and improving it and expanding it. So improving it by eliminating financial barriers, no deductibles, no co-pays, no co-insurance, and adding dental and hearing. I mean, your eyes and your ears are part of your head, they're part of your whole body, they're part of your health. They should be included. This is a no-brainer. In fact, so much of dental health is related to other health. It's like different chronic diseases. So dental care is crucial. Another component of Medicare for all is to expand it. First and foremost, include it for every American. And eliminate those wasteful overhead. There's no need to pay for these administrative costs that don't actually do anything. And so this is the idea behind Medicare for all. And so how do we actually get Medicare for all and how can we pass it? Well, we do have current legislation already for Medicare for all. We have legislation in the House and in the Senate. So now how do we get Congress to pass it? Well, Congress is a little too busy serving to their corporate, being puppets for different corporations and big pharma. Earlier this year, we saw how Manchin completely stonewalled and stopped the Build Back Better bill. The Build Back Better bill would have pulled so many working families out of poverty and given them crucial need and money and income and jobs, especially now during this time of this pandemic. Manchin is the 51 vote in order to push the bill, and he stonewalled it through many different ways. One of the ways was he said, let's cut $2 trillion from this $3 trillion budget. And he wanted to target not allowing children essentially to get food. And then he kept proposing different things to be cut from the bill. And at the end, he didn't even sign it. It didn't even pass. And so we know that current Congress legislators are not actually fighting for our best interests. Instead, they're too busy spending all this time on warfare. We use so much of our tax dollars for warfare, as you can see in this graph, the amount of money that we use for militarism and war compared to health, as well as housing and education, because of course, housing and education are also related to health. They are all interconnected. And then earlier this year, we also saw how Congress passed a groundbreaking $777 billion military budget. And even before that, they passed a $1 billion budget for Israel to have an Iron Dome. Congress is spending too much time paying for these corporations rather than actually investing in the people. Israel already is the largest recipient of military weapons from the US. Israel receives $3.8 billion every year from our tax money. And so there's no need even for this Iron Dome, and there's no need to even fund any of these different countries. And the thing is, this is so important. I say this not just because I'm Palestinian, but because these are our tax dollars that then go and oppress Palestinians, but also Israel is active in oppressing Lebanese and Syrians and Yemenis and other Arabs. Israel also is the only country in the world who sells weapons to the Burma military, who then oppress Rohingyas. India is also the largest buyer of weapons from Israel, which then they use to oppress Kashmiris and Muslims. And so where our money goes is connected in oppressing people, oppressed people across the world. And we need to bring our tax dollars home and invest in us and invest in healthcare. North Carolina alone spends $83 million to Israel. And instead, this money cannot just be used for healthcare, but can be used for education, such as paying over 1,000 elementary school teachers, can be used for food, such as over 55,000 people can receive food assistance in North Carolina. And so it is crucial that we invest in us and fight for us. And one of the big questions that you always hear is, can we actually afford Medicare for all? Yes, we can. All this money that goes to military can be used for healthcare, but not just that. 95% of households will pay less in taxes, the taxes that are going to be called Medicare premiums, than they currently pay right now in premiums, copays, and prescriptions for full coverage. So yes, absolutely, we can afford Medicare for all. And the thing is, we're already paying for it. 2/3 of our current healthcare spending comes from our taxes. This graph shows how 64.3% of healthcare spending is already public. So the funds already exist. And however, the issue is that there's so many people who are uninsured or have very poor access to healthcare, as well as mental health and other issues previously described. And in North Carolina alone, it's estimated over 50% of people who are uninsured are from minoritized racial ethnic backgrounds. Even here, this graph shows the percent of uninsured by race ethnicity, and you can see how it disproportionately impacts racial ethnic minorities. And then, of course, due to limitations in the way that data is collected, a lot of different groups get lumped into other, such as myself, Arab, and then earlier, Sister Hena even talked about the diversity of Muslim groups. And so we're unable, using current data, to really understand the impact among different marginalized groups. And of course, the percent of uninsured also impacts those who are poor. And then we know the disproportionate impact between those who are poor and of a racial ethnic minority, particularly in North Carolina. Poor Black people are especially targeted by these horrible health insurance systems and have inadequate access for health insurance. I see that I am over time. I will try to wrap up in like 2 minutes. I'm sorry. This graph over here also shows how those who are employed even also have inadequate access for health insurance. And as previously talked about, the current health conditions in the US are horrible. I am a public health professional myself, and I can tell you that the statistics and life expectancy within the US are really bad and and do not compare to other industrialized countries that are of similar wealth to the US. This graph here shows how infant mortality rate is much higher in the US compared to these other countries. Likewise, we also see high rates in the US of patients skipping healthcare. And of course, you can understand how skipping healthcare, an appointment, treatment, or taking medication is then going to be detrimental to your health in the long term. And so, of course, given where we are, we must fight for Medicare for all. Fighting for Medicare for all will increase worker empowerment. It lets people switch jobs without fear of losing coverage, which is a huge, huge advantage and needed. It lets you become a small business owner or open up other businesses that you're interested in. It can help reduce these racial ethnic disparities that I only briefly touched on. And there are so many other benefits for Medicare for all and why we should fight for it. And the best thing is that many people already agree for Medicare for all. This graph shows how in 2020, 72% of Americans want government-run healthcare plan. And even many healthcare professionals also endorse Medicare for all. We can see here many doctors and physicians and even nurses, because the Medicare for All campaign, the national campaign, is launched by the National Nurses United Union. And so we can see that there's so much support for this, but then how do we do it? Well, how do we get anything? We know that Congress is not going to pass it alone. The way these movements work is through mass struggle. And so a really empowering example that happened a few months ago in Indianapolis. The Medicare for All Coalition there got their city and county council to endorse Medicare for All. The city and county council representatives didn't just say, oh yes, we should support Medicare for All. This was a people's movement. This came from the masses, and we must do the same thing here in North Carolina, and also wherever folks are if you're not in North Carolina. But for those who are, we ask you to join us as Muslims for Social Justice, be part of the movement so that we can support and win healthcare for all, because this is what we deserve. So thank you for listening. I know I went like 4 minutes over time, but I really hope and encourage you all to join us and be part of the movement, join Muslims for Social Justice as we fight for and win healthcare for all. Thank you.
Thank you. Thank you so much, Dana. That was powerful. Thank you to all the speakers for powerful presentations. With the time limit, I'm going to move forward with Brother Munir to do the Q&A. So please, Brother Munir, you can take over from here. Thank you. And you have to unmute yourself, Brother Munir, if you're speaking.
Yes. Assalamu alaikum. Can everyone hear me?
Yes, we can hear you.
Welcome.
Great, great.
I can hear you.
Assalamu alaikum. I'm going to start with the questions that I have written down already. And if I don't pronounce your name properly, please forgive me. Salama Al Hassan asked a question about how do we factor in people's backgrounds when creating a safe space. And this makes me think about ways we let people express themselves and what is appropriate. And the standards, I believe she's talking about mental health, tend to neglect people of color. So Sister Ruqayyah, is that a question you can answer? You're on mute. Mr. Ruqayyah, unmute.
Yes, yes. He's talking about ways we let people express themselves and what is appropriate. People can express themselves however they want, particularly at the beginning of your journey with them, because that's where they are. So you listen to them. Now, you don't have to feel like you have to express yourself in that same way when you talk back to them. You keep your standard, but they can express themselves however they want. The actual experience of people of color, especially trauma of Black and Indigenous populations, is such a big, it's such a big topic. And we have a lot to do in the community aspect, in our families. You know, I talked about creating programs for productive families, creating programs that we can do in the community. All of these are little steps that we can take. But in terms of people expressing themselves, there's no way to say what's appropriate and what's not appropriate. Let the people speak as they wish. So that's what my answer is. What my answer would be there. Ask questions. You know, when people talk about their experience, how did that make you feel? Try to get people to speak more about what's happening inside of themselves internally. If they talked about an experience with someone, how did that make you feel? Well, how did you feel the next morning? Were you able to go about your normal day? Did you find that this incident caused you to stop in your day? Did you seek help? Did you talk to someone else? You know, those types of things is how I would answer that question.
All right, thank you, Sister Ruqayyah. And also, Lama has another question. With the same mental health approaches that you were sharing earlier about mental health first aid, be appropriate for adults and children?
Oh yes, the program for adults, youth, the aging, what you call seniors, they basically run around those same 5 steps, the ALGE steps, assessing for risk of suicide or harm, listening non-judgmentally, giving encouragement, encouraging appropriate self-help and encouraging professional help. All those steps are applied to the different populations. Of course, it has to be tweaked and different. For example, the youth mental health first aid, that training is not at this point given to youth, it's given to people who work with youth and such, but there is now an effort to actually train young people in high schools and such to be able to help their fellow students. Yeah, so, but most of those steps are the same, they're just tweaked and applied differently.
Okay, great.
If you're interested in mental health first aid, I was looking to see if there's any trainings for mental health first aid in the Raleigh-Durham area. I didn't find any yet, but I'll continue looking for that and see. I know a friend there in Durham told me she went to a training, and I'll just keep looking to see which organization are you affiliated with, Lama? That I can connect back with you.
I'm actually in Florida, but I can reach out to you.
All right, okay. So yeah, we can look for trainings down there in Florida as well.
Okay, great. So Ruqayyah, are there any trainings done online, or does it all have to be in person?
Yes, they're all online now. Since 2020, all the mental health first aid trainings have been online. They at the same time that they went online, they also rolled out a new training that's more culturally competent, more relevant to different populations. So yes, the trainings are all online now. The training actually used to be a 12-hour training. You had to go for 2 days, 6 hours each, then it went down to 8 hours. With the online training now, there's a certain portion of the pre-work that you do individually, and then you join in a group training. So now it's down to about 5 hours, 5.5 hours.
Okay, great, thank you. Yeah, I'm encouraging everyone to look at taking these mental health trainings. We have a lot of hidden mental health issues in our community, and all of our communities can benefit from having trained citizens that can help our family and friends in mental health issues. I'm definitely interested in that. Thank you for sharing that, sister.
You're most welcome. Thank you for the question.
Sure. And we have Brenda Hines that says she wanted to add a comment during Q&A. And while Brenda is unmuting herself and making her comment, if anyone else has questions for the other panelists, please put them in the chat so we can share them. Thank you. Brenda, go ahead.
Thank you. Thank you all for this. And I'm very encouraged by the whole conversation and all the conversations. And I wanted to make a comment first about even if you have insurance, sometimes the way the capitalist system works sometimes is that even if you have insurance and going to the doctor, I had a sister who would for somehow wind up in the hospital for 2 years straight, but not this year. She didn't wind in January. And we couldn't figure out what was wrong with her. Like either she had fallen out or something, but it made it to the point that she was in the hospital. So she went back and forth to the doctor, and she stayed employed until her medical leave ran out. And I'm sure she didn't realize that it had ran out when it did. And then now she can't really go to the doctor or have that medical coverage anymore. So, but the doctors went back and forth and no one could really give her a final plan as to how she can get well. That they wanted more tests, more expensive tests. That only to the point to where she had insurance. So that I wanted to put that out there in terms of the comment, in terms of it is really important that everybody have medical coverage as a human right, not at the risk, not because you have an employer that covers you to that extent. And I just wanted to make the other comment that the importance to me of what I'm taking away from this conversations that I've heard, it is an opportunity for us to reconnect to the community and help organize ourselves on so many levels. But it's really, really a big opportunity from everything that we're experiencing in this country as Black people and other people of color. That's all. Thank you.
Okay, thank you very much, Brenda, for sharing that. I think it is important that we do stay in touch with each other as a community. Sister Hena spoke about that earlier, and we just need more of what we have going on right now.
Exactly.
let me see at this point. I'm getting back to the bottom of the chat to see if there's any more questions that were added. There wasn't any in there when I went to the top. I was trying to get the resource guide that we put together to copy the link to share with everyone, but I was having trouble copying it. So is there anyone else, any of the panelists, anyone else want to make a statement before I turn it back over so we can close out? Anyone else had any other comments they wanted to make quickly? We only have 1 minute actually.
Yes, I did. I saw a question. Can we please speak on how we can prevent mental health crises, not accept them as something inevitable? That is a big question. But when we look again, as you speak about family and community, and we talk about protective factors, those of us who, we know what protective factors are, right? Like how to prevent auto accidents. You follow the traffic laws, you get a license, you stop when the light is red, you go when the light is green. Everybody gets a chance. When society among people, there's laws too in human society. And those are broken. We can't say they will never be inevitable because some people have genetic factors and such. How can we treat them? And also, but protective factors are very important, starting from the family and childhood. I see Shafeah is jumping in there. So that's a very big question. But again, community is important. We say community is needed, or village is needed to raise a child. A village is needed to raise a human being. A human being needs a village. A human being needs people to talk to. And a human being needs communication. A human being needs social interaction. And the prayer and the spiritual factors. We see that that's another part of what we all need. And you see, and then when we talk about rights, okay, the first and most greatest right is the right of God to be worshipped. If you have a society not built on the greatest right, that's the supreme right, the right of God to be worshipped. And if society develops on that principle and trickles down, there's more fair space for everybody. Because worshiping him first, you set up systems in such a society to keep people worshiping, keep them well. And one of the most important aspects of mental health is it keeps people from their first and primalist duty is to worship their God, right? We want people to be wealthy, but to be healthy and well and functioning so that their worship can be perfected, so that we can all see their positive future on the other side. That is a really big picture, and so we're having to deal with all these little pebbles in the stream. But the big picture is that, the future life. And so we do everything here so we can help all of us to make that transition to a place where we won't have to worry about any of this again.
Thank you, Sister Ruqayyah. Appreciate it. All right, I'm going to turn this back over to the moderator so they can go ahead and finish up and close us out. Thank you, everyone, for participating. Thank you for all our panelists. Everybody did a great job.
Thank you, Brother Munir. Thank you, Brother Munir. Many, 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 many thanks to Sister Cleo and Dana and Ruqayyah for the presentations. Brother Munir for compiling this list of resources. There's really not a whole lot to, thank you. I'm sorry, Hena, thank you. Hena, I didn't mean to leave you out. There's not really a whole lot that I think that needs to be added to the points that Sister Ruqayyah just made, except that Muslims for Social Justice, and we will address separately the question around individually, the question around Muslims for Social Justice chapters in other states. Except that we want to add with our theme, our foundation, that we are commanded to stand for justice. And we are commanded to actively stand for justice. Our faith says that if you cannot then stand for justice, then you at least must speak out for justice and against oppression. And if you cannot speak out and stand against injustice and oppression, then you must at least hate it in your heart. And some people say, why would you want to be known to have the weakest of faith? And so with that note, we want to close out with a video This video is from the Emmy Award, Emmy nominated movie called Takeover. And it is also referred to by Sister Cleo earlier on. And it is about the takeover of Lincoln Hospital by the people, led by the Young Lords Party and the Black Panther Party in 1970. Assalamu alaikum. Thank you all for your support and participation. We will follow up with you. We don't have any sound.
This is a story from New York, not the New York of Manhattan and Broadway, but from perhaps the toughest square mile in the city, in the South Bronx.
I was 14 years old when I joined the Young Lords. The Young Lords were a street gang that became politicized by the Black Panther Party.
We became visible as servants of the people. And the people began to understand that New York City offers no solution for spics or niggas or anyone else who's oppressed.
One of our targets was Lincoln Hospital.
That building was condemned 25 years ago. Condemned for rich people and opened up for poor people.
It was a place that you went to die.
Lincoln was called the butcher shop.
Blood stains on the walls, blood stains on the floors.
And there was a rat in the emergency room.
We have seen children get lead poisoning while hospitalized at Lincoln Hospital.
We felt now it's time for us to say exactly how we're going to respond to the killings of our people.
Our plan was to take over Lincoln Hospital.
We have to begin to stand up for the people, the Puerto Rican people, and say that's enough. That's enough.
We've been asking for changes to take place. Paid no attention to us. Thrown us out of your office, and you've called the cops on us. And now we're putting you out. We've taken over a hospital. We're gonna run it. You're out, and I will walk you to your car.
We immediately announced that we were not leaving until the city made a firm commitment to building the hospital.
From El Barrio to Arecibo,
About 1,000 police were en route with high-powered rifles. They had vans all over the place.
If the police came in, it was going to be blood because the police hated the police.
We were terrified.
you all had to hide
Power to the people means including people to gain control of their destiny.
The Young Lords were ahead of our time in terms of recognizing that healthcare is a right.
One morning, a revolutionary change to the health system in this country, and we still do.
You all who came before we say
Of course, no oppressor is invincible.
Okay, thank you so much. That was powerful. Thank you so much, everyone, for joining us. And I wanted to say we have recorded, and we will be, inshallah, emailing you the materials to all. So thank you so much. I don't know, Sister Shafeah, if you also want to close at the end.
I'm good, brother.
Thank you so much. That was a very good, decent turnout, very powerful conversation. We look forward to working with you all, inshallah. Thank you so much. Assalamu alaikum.
Wa alaikum salam.